I have some bad news for you. At some point in your life, you're probably gonna need to visit a physical therapist. It's gonna come because you have some sort of injury. It's gonna come just as a result of maybe the natural aging process. It might be something like an ACL tear in a sport. It might be something like a total joint replacement later on in your life. Many of you will experience back pain at some point in your life, and you're gonna want a physical therapist to help you target the correct muscles and understand how they can give you the best therapy modalities so that you can return to the things that you once loved to do. Now, physical therapy is an incredible science. And what's happened over the course of probably the last couple of decades is that biomechanics has helped inform some of the things that we do in physical therapy settings. And I'm gonna give you a really cool example that I just saw recently in one of my classes. So one of the things that I look at a lot in biomechanics is the ground reaction force, which is just the person's ability to push on the ground to create motion. And I looked at one of my students. So this student had had an ACL tear. Common thing for my students, very common in our female athletes, but even becoming more common now in our male athletes. The rates of ACL tears are just going up and up as more people play sports and we start to move faster. And I grabbed this individual. He had been about maybe 2-3 years post ACL tear, meaning it had been a pretty long time since he had injured this joint. You'd expect for him to be moving like he was before he had this ACL tear. And I brought him into class and I put him on a set of force plates, right? This technology of biomechanics is getting so incredible now that it's becoming more and more portable, more accessible. You don't always have to come into a fancy lab like the one I have here at UVU to get this analysis done. Biomechanics is starting to go out to these physical therapy clinics and to strength and conditioning coaches. And so that's what I did with these portable plates. I set him down and I had this individual stand up out of a chair. And my class was amazed at what they saw. Because what they saw is on his good knee, meaning the knee that had not had the ACL tear, he was generating almost 2 to 3 times the amount of force than he was on his leg that was injured 2 or 3 years previously. Now, what does that mean if he's compensating still, right? We'd call that asymmetry, meaning one of those legs is stronger than the other and is producing more force. He's still compensating 2 to 3 years after this injury. Well, what are the risks for someone post-ACL tear? And again, if you're a fan of sports, you know that the issue with players post-ACL tear is when is that second one coming? And biomechanics is a really cool science that can help inform some of the decisions that physical therapists would make. Now, we looked at the way this person stood up out of a chair. We watched the way they kind of went down and came back up. And what we actually saw was that his biggest issue was not actually in the going down movement, it was actually in the coming up movement. And what that allows you to do as a physical therapist, if you are measuring that type of motion on some of your patients, is we now know exactly how to target this individual's therapy. We can go right into that leg that's had the ACL tear, and we can do things like a series of single leg activities where we're really forcing that leg to work a little bit harder, and we're doing that during up motions, right? Think the up phase of a squat or standing up out of a chair. And that scientific information that we get from biomechanics allows a physical therapist to jump in and not just assume that that player has regained all of their strength and flexibility and speed because it's been 9 months post ACL tear, but we can actually pinpoint measure where those differences are. And this can help inform our therapy decisions and our training. Another cool example I had was actually with my father-in-law who had a stroke. And we were able to look with his therapist at some of the way his gait changed. Now, gait in biomechanics is just a fancy way to say, how did he walk? How did he move? And I actually had some of my father-in-law's data prior to him having a stroke. And when I went and met with his therapist was just amazed that we had this data. And we would compare him side by side after his injury. And I could step in at every point and tell the therapist, hey, the knee's not working the way it was before his stroke. The hip's not working the way before his stroke. And then he would target that for the next couple of weeks. We'd bring him in and he would be moving better. Now, again, what's really cool about this is that because this technology is getting more portable, better, cheaper, more physical therapists are gonna have this capacity in the future. Biomechanics is gonna help revolutionize the way that physical therapists not only measure the way that an individual's moving, but start to measure the progress of how effective their exercises are, giving you that fine-tuned training program that you need to return the things that you love to do. And that's a part of biomechanics that I think is directly applicable to almost everyone, because at some point we're all gonna get injured and we're gonna want to have someone improve the way that we move. If you wanna see how this principle is related to athletes, check out the next video where we dive into these same principles, but in how to make athletes bigger, faster, and stronger.